Hey, Kaylee. Hey, Christine.
Hi. Hi, how are you?
Good, thanks. How are you?
Not too bad.
Hey, Roseanne. Alice, because I can't help myself, I'm looking at your board of directors. So you've got Dean Bulmer on your board, which is fantastic. And you have a member of the CGA, which is always prudent. So hey, Tracy, how are you?
Good afternoon. I'm well. How are you?
Excellent, thank you.
Good.
We just merged with the Farnham Neighborhood House, which is on Fillmore Street, and a couple of board members moved over from there. So
Nice.
yeah.
Just
Hey,
so
Katie.
where we are live on YouTube, and we will be starting to record in a moment.
Thank you.
Thank you. Hey, Carol. Hey, Katie.
It is 3:30. Maybe we can introduce Alice. I
Sure.
think this is your first meeting, is it not? Would you like to introduce yourself to those members who are here? We're happy to have you. Thanks for joining us.
Thank you. Thanks for inviting me. My name is Alice Forster. I'm the CEO at Clifford Beers, which is a nonprofit community mental health agency located in the greater New Haven region, as well as our Mid-Fairfield colleagues down in Norwalk. And we are also partnering with Youth Continuum, which is a homeless transitional housing for youth 16 to 24, and Farnham Neighborhood House, which has 3 school readiness classrooms. So we're kind of got our fingers in a bunch of little things. So
Excellent.
Welcome.
Thank you.
thank you.
Is there another new member here? There were 2 new members. I don't know if the second is here.
Mark Polzella wasn't here the last time.
There. Okay, Mark, that's great. Maybe you can introduce yourself if you don't
Hey,
mind.
everybody. Yep, I was here last time, but I stayed quiet because I was very interested in the
okay.
conversation and learning a lot about what you're looking to accomplish. I'm Mark Polzella. I am the Deputy Commissioner at the Connecticut Department of Labor and happy to be part of the task force. So thank you.
Thank you.
Thank you.
And there was one other new appointee besides Alice. Who was that, Peter? Can you help me with that? Who that was? Do you remember?
I don't have it right in front of me, but I'll get it quick.
Okay. Yeah, me now. I just want to make sure that everyone feels welcome. think one of my students is learning how to play the trumpet outside my window, so I apologize, but it's okay, as long as you know it's no clarion call for anything, it's just practicing. We encourage it outside because of the, COVID also, so he's taking advantage of that. Anyone who was not here last time? We're waiting. Great. Well, we are recording. It's already started in case you missed Peter stating that. So it's important to remember that as well. And it is live on YouTube. So what do you think, Christopher? Shall we begin?
Yeah, I think so, just to be respectful of everyone's time.
Yes.
And since the clocks have changed and we're all going to start fading pretty quickly.
My students are saying that all day today. So yes, that was the excuse for everything today. We do have notes from the last meeting of the 18th posted as an agenda item. Did anyone have any comments or questions based on those notes?
I just want to say that I'm grateful to Peter and Heather for
Thank you.
keeping such meticulous notes. It's a big help to us.
Yes, thank you. While you are doing that also, we were asked at the last meeting to clarify the expectations of this task force. So they are listed as number 3 on the agenda.
And Alicia,
Yes.
I'm going to share my screen so that we can see the agenda and see those see the charge of the task force.
Okay.
Yeah, so just as Alicia indicated, we copied and pasted the language directly from the statute so that we can go over what our charge is.
Can you blow that up, Christopher,
Oh.
a little bit? Yeah.
Yeah, let me.
Change the 100% at the top. You could do it. Oh yeah, you're going the wrong direction.
Oh, see, I did it perfectly on my end. It looks good. All right, so let's.
Yeah, that'd be great.
Is that better?
Yes. Going to go a little bit high, a little bit more even? Yes.
Sure. All right.
There, now we can see that all. Yes.
Perfect. Yeah, so the statute reads that our task force's charge is to identify the needs of children using the 5 tenets of the Whole Child Initiative, and we'll talk a little bit more about that going forward. That we are to recommend new programs or changes to existing ones operated by educators or local or state agencies to better address the needs of children in Connecticut. To recognize any exceptional efforts to meet the comprehensive needs of children by educators, community members, or local or state agencies. To identify and advocate for resources, including but not limited to funds required to meet the needs of children in the state. To identify redundancies in existing services or programs for children and advocate for the elimination of such redundancies. And to assess all publicly available data concerning the comprehensive needs of children identified pursuant to subdivision 1, and to collect or make recommendations for the state to collect any data that is not already being collected by educators, community members, or local or state agencies.
And we did put the bill there too, so you can see it exactly there on those pages if you wanted to look at it yourself.
Right. So the 3 pages from the statute that address our task force
Right.
outline the charge, and they outline who is going to be peopling the task force. So that's our goal. What Alicia
Are there any
and I
questions there? Any questions on those while we have that up? Or comments there?
This is Alice. I have a defining question. When I was reading the minutes and the bill, when you're saying the Whole Child Initiative, is there a specific one that you're asking about? Or I've been working very closely with UConn on the whole child, whole community, whole school approach, but I don't know exactly what is meant. And I apologize if it was discussed in the last meeting.
No, actually, that's a perfect segue, Alice, to our next bit. So let me stop sharing this page and I'll share the next one. So, the whole child framework, with which you're familiar through your work, was established in part by ASCD, but along with some other organizations. And the 5 tenets are that every child be healthy, safe, engaged, supported, and challenged. But I think the important piece for us, and one of the reasons why we were keen to have the legislation passed, was that so many of the needs of children have been given to schools to address. And while schools certainly have a role to play, schools can't do it by themselves. And so the hope was that if all of the agencies who are already working with kids and families were sort of able to share information with each other, then we could identify where any gaps remained. And then speaking with one voice, communicate to the legislature what needs existed and what resources were required to meet those needs. And so what Alicia, who is a school principal, and I, who used to be one, thought that what we could do with this meeting and with the next meeting was to sort of do some brainstorming specific to each of the tenets about what we recognize from each of our various vantage points as the needs for kids. We had also asked Alice, and we can sort of brief you later, we're using a Google sort of folder. So it's as a sort of compendium. So different agencies have been submitting over the last week or so, their various goals and objectives and priorities. And as they come in, I've created sort of a subfolder for each agency. So we have 1, 2, 3, 4. So we have 5 agencies who've already been able to provide that work, and the others are in the process. So between our conversations at these meetings and what people are able to provide in writing, we will be creating a report that we need to actually get to the CGA by January the 1st. And so that's why we're going pretty quickly, so that we can do this work as quickly as we can, but as comprehensively. So.
And thank you to those people who have already turned in. Some of you already separated your information by the 5 tenets, so it's been very helpful. Whatever you have, we will definitely take, but wanted to make note of that too, and thank you for that work. Does that help, Alice?
Great.
Yeah, and I'm sure I'll learn more today.
Right, absolutely.
So what I did, Alicia, is I can continue sharing. I just sort of have a blank document or a blank page for each of the 2 tenets that we're going to deal with today. And so if you don't mind facilitating the conversation, I can type, or if you want to do vice versa, that's fine with me, whichever.
Well, do you want to share and put them up there? That would be fine. And then, of course, interject at any point. Yeah, like you would. Okay. I expect that.
I actually thought I was sharing. Thank you for pointing that out.
No, yeah, it's gone. There we go.
Okay.
And to see if you can blow it up again just a bit, because it seems to be a bit smaller.
All right. So this is just the page with healthy,
right,
on which we'll take the notes.
Yes. Okay. So you can go back and look yourself at the agenda, and you will see that top part that he's showing you right now. If you want to look at what is under healthy, what we've considered and been described as important to healthy. And these are the elements we're going to try to see if we can't distill today from each one of your respective departments or who you represent. So if you could think about healthy, and then think about safe today. And then as you see for the next agenda, we put it down there. We will conclude, because then we only have one more meeting to try to pull and show you what we've done to date and get your feedback on all that we've pulled together, so that we can submit it by the January 1st deadline. How does that sound, Christopher?
I think that sounds good. Hopefully it sounds good to the others.
Right. Make sure that's what we talked about. Any questions? Let's open it up then and make sure, does that sound okay for everyone? Would that be a nice way for us to approach to try to get everybody's perspective? Even if you couldn't submit any documents, then we can get your information today and we'll be happy to do that. I see some heads nodding. Thank you for that.
On that rubric to make sure we're hitting all of the points needed.
This is Anne Marie Cullen, and I'm very comfortable
Thank you.
with the way you've set it up. Thank you for that direction. I think that makes a lot of sense so that we can look at the tenets of the whole child and really apply them to our specific areas. And
Thank
you're
you.
right, it's a very short time frame for us to get something to the legislature by the time they open session. So thank you to the chairs for doing this.
Thank you.
Grab your notebook and pencil. We're going to move.
Thanks, Emery.
Okay, then I guess, go ahead, please, Christopher.
Oh, no, I was just going to say, I just sort of have a technical glitch in that because I'm sharing my screen, I can't see everybody. So Anne-Marie,
right.
I'm sorry, Alicia, if you don't mind sort of doing the calling on
Right.
that sort of thing, I'll just type.
Well, I would think so. If we look at healthy, I would like for people to have the opportunity first to share, and then at the end we can go, because he is sharing the screen, we are all with that same, we have just a few people that we can see across our screens so that we have enough screen space to see what is being shared. So would anyone, if not, that's fine. We'll give you some time to just think first. But is there anyone, and I forget who it was, some of you already did share, and maybe you want to just reiterate what you had stated, so people who didn't look at the folder have the opportunity to do that, can hear what you've already shared, and then we can continue on with anybody else who would like to share. It sounds like somebody is getting ready to share. Then let's, I'll do, I will look, because I know we have, let me just find my folder here, because people did share some things with us already. And we can just, or you can look at this too, if you're trying for yourself to see what was shared, what people have shared already. Under the asterisk task force column is what we're talking about right now and the agenda, but then the agencies have submitted some work in the next subfolder, and you can see what they have submitted. So CHRO, for example, has submitted about anti-discrimination work that they're doing and how they can file complaints about or on behalf of their children, and talking about their complaints regarding discrimination for housing. They also are looking in the future under healthy to look at the systemic inequities for lower income children, children of color regarding access to healthcare. Definitely important. All of these are, and then working on reforms for people to have affordable housing. So this has already been submitted. Again, as an example, if you're trying to think of what might be germane to your agency and how that can help fit the requirements of this committee. Housing, we can look some more there. There's some other information there. Judiciary has submitted some general work that we can look at under education. They also have some case management, medical services. So there are things there they've submitted that can be and will be helpful to us. And then we also have mental health and addiction services that has submitted priorities. And there is, I'm calling it up now, there is a listing there on, I think it's a couple of pages, and have already gone through and labeled some of those. So examples of healthy there are school health, school-based health centers, support groups, could also be under support they listed, expanded treatment services for different kinds of addictions, also including youth support groups and alternative activities. Continue to scroll down and see about the climbing rate of mental health concerns and having ideally some additional inpatient or urgent care treatment settings for those children who have needs. Looking at outpatient mental health services. You can't get all this, Christopher. It's all here on the agenda. Right. Pick a couple, and then we will go back certainly and look for some more. And they've also put as healthy, ensuring that youth, regardless of insurance, can access a comprehensive system of care. So these are some examples already submitted with the delineation so that we can use those when we create our final report. So based on that, does anyone have anything to add, and who would like to go first or next?
Mark has his hand up.
Great, please.
Hi, everybody. So when I'm looking at the healthy, I think the thing that stands out most for the Connecticut Department of Labor and our partners with the Regional Workforce Development Boards and the Office for Workforce Strategy falls in the area of economic security in terms of providing parents with consistent income. Obviously, a lot of folks know the Department of Labor administers the unemployment insurance program, so that's a direct income assistance program for folks who are unemployed. And then we have several employment and training programs that we operate, both federal and state funded, all geared towards helping folks get back to work or increasing their career opportunities, or getting them on a trajectory where they can lead to self-sustaining wages. So I think a lot of our stuff falls under there. Now, do you want descriptions of all those types of programs?
If you would like, go ahead.
I was just going to say, I think, like thumbnail sketches are really helpful. We don't necessarily need to be terribly meaty, but I do think, that the kinds of programs that your department administers probably need more resources in order to do the job more fully, or as fully as you would like for them to do. And I think in that regard, it would be helpful to have some numbers.
Okay.
Because I think ultimately what we want to do, and actually this is helpful for those who weren't here the last time.
Yes.
When we write this report, our committee, our task force was created under the legislation that was spearheaded by the Committee on Children. But I think for us to have the impact that we want to have, we cannot just testify to the Committee on Children. We need to get on the radars and on the schedules of all of the committees of jurisdiction. And since that's the case, we want to be as specific in what we're asking for. So I think, we don't need, as I say, we don't need more than thumbnail sketches of the programs that exist, but we do want to be able to have specific asks, because I think that that's what legislators tend to look for.
Okay,
So,
great.
Thank you.
Yep, then I can start working on putting that information together.
Right. So anything that you're looking at asking legislature for that we can support, we'd like to put that in our report so that we continue to help you to move forward with your requests that can help support the child. That'd be great.
Okay, great. Thank you.
Thank you.
Kaylee, your hand was up, and then
Excellent.
Then Tracy.
Hi, everyone. Again, I'm Kaylee Royston from the Department of Agriculture. And when I'm looking specifically at healthy, I'm looking at nutrition, primarily because the Department of Agriculture does administer the Farmers Market Nutrition Program, which we do have a WIC component and a seniors component. The WIC component is done in conjunction with another state agency, not just ours, but a number of these farmers markets do provide SNAP doubling or resources to WIC recipients. In addition to that, we did just launch our Connecticut Grown for Connecticut Kids grant program, which is a school-based program, or a school or nonprofit-based program. to either get healthy food or educate youth on the farm to school kind of transition period. And I think both of those are contributing factors from the Department of Agriculture. A lot of our programs, while not primarily focused on children, are encompassing of the entire household. So we do have those farmers market nutrition programs are geared towards specific recipients, and there is often an income based, and we do see a really low redemption rate from those WIC program recipients. And I think we've been focusing on it. We've talked to our food policy councils about how to increase redemption rates from those WIC recipients specifically, because it is underutilized.
And can you repeat the name of that Connecticut grown, Connecticut, what was it? Kayla?
It's Connecticut Grown for Connecticut Kids. The grant program launched last week.
Okay.
And if you give me like 30 seconds, I'll be able to give you the statutory reference.
You can email that to us.
Perfect.
Nice.
Or put it in the chat,
can
like you can paste.
Start to blur in your head after a bit.
For sure. Kaylee, can I ask you, when you're talking about low redemption rates, specifically for the WIC recipients, is that just for the farmers markets?
So we have the farmers market nutrition program, which they are redeemable at farmers market and farm stands.
Right.
And
But, so
we see low redemption rates there.
So my question was, and when I was in Vista a bazillion years ago, and I was a very spoiled kid, so I like completely clueless as to the world. There was a woman my age who sat next to me at a meeting, and she said, being poor is a full-time job. And I asked her what she meant, and then she explained all of the buses she had needed to take to get from Amesbury, Massachusetts to Haverhill, Massachusetts, where our meeting was.
Mhm.
So that leads me to ask, do you think is it a transportation issue? Is it harder to get to the farmers markets? What's your theory?
I don't think so.
Okay.
We have seen a number of growing farmers markets in more urban communities, which is great. And particularly through COVID, we saw an increase in the amount of people who were coming to farmers markets. They were seen as a safe alternative to going to the grocery store. They were very heavily utilized over the last 2 years. And WIC recipients and senior recipients are eligible to get additional vouchers. I think it is just an underutilized program. We do over distribute, and it is not specific to one area of the state.
Okay.
Can you add?
We closed our redemption rates on October 31st, and we should have those numbers shortly, but we did just close our season, so.
Okay.
Can you add farm stand after farmers market? I think it's both, right, Kaylee?
So the farmers market nutrition program is the title of the program.
Okay. Okay. But it does include, okay, fine. That's fine. Great. Is it, I've seen this advertised. Is it any burden for the people who are trying to sell to have to administer that? That's not any reason why it's not.
No. Most of the farmers markets in the state do utilize this redemption program. They are done in $3 vouchers, and they are well received. They are utilized at almost every farmers market, and particularly as we got increased funding to do SNAP doubling and increased outgrown campaign last year to revitalize and rebrand the movement. So there's been a lot of conversation about it, but any effort to increase awareness to these programs is always great.
Right. Thank you. Was there a next hand raised?
Tracy Duran.
Tracy, okay.
Oh, no, yes, Tracy.
Hi, everyone. Tracy Duran from the Judicial Branch. I just wanted to bring up a comment that was already noted by you, Christopher, on the climbing rate of mental health concerns. This is very specific for our JJ kids. What I can say is Judicial Branch, we do a great job with kids who are currently detained or in our system with managing their mental and emotional as well as medical needs. But where we are finding a big gap is particularly now due to COVID, we are seeing more and more kids with acute mental health symptoms and symptomology and needing that acute care at the time of whether they're detained or not. And we have struggled over the last year or so of getting kids hospitalized, psychiatrically hospitalized. This has been an ongoing issue. I think, we're trying to build better networking and relationships with the behavioral health system and DCF. But it's been an ongoing concern because unfortunately, many acute inpatient units, they deny our kids. Our kids are kind of considered excluded because of their level of violence or aggression. So I want to put that out there because, I think it was mentioned, I'm sure other agencies have seen this kind of climb in more acute, more serious mental health. We're seeing a lot more concerning substance use, particularly opiate use with younger kids. That is definitely a gap in our services that we have in judicial. And trying to find other services within DCF or within the behavioral health system has been challenging. I mean, these kids are just at a place that we're at a loss what to do. And many times, they remain detained just, until we can find that appropriate intervention. So I just wanted to mention that. And I'd love to hear from other agencies to see what they're doing to, about this, and if they have any ideas of how we can better network with other agencies.
Thank you. I'm actually aware of students myself with this, so I know exactly what you're talking about from firsthand information. Colin, your hand is up.
Yes, hi everyone. Colin Huston down here at the Norwalk Board of Education. And I think it's such a great list so far. One thing I wanted to just add, of course, from this perspective of public schools, we've seen how important our schools have been in terms of public health in the age of COVID. One of the things that I've been concerned about that's related to getting our young ones vaccinated is the falling rates of vaccines in general for young people in Connecticut. And I think the stat that I saw most recently was in 2019, there were over 130 towns in Connecticut where the youth vaccination rate for MMR had fallen below the federal guidelines of 95%. And, it's unfortunate that that's something like that kind of public health issue has become political. But it's a real problem. These are infectious diseases that we have managed to get some kind of control over, and I think we're slipping back into some dangerous territory when we have our vaccination rates fall that precipitously.
Thank you. Alice, probably you need more time, so you're next on my screen, but I'll be happy to pass over you.
I can
Please.
talk for a few minutes. I'm on the Connecticut Behavioral Health Partnership, and certainly children's mental health has been top of our conversation, and I'm on the DEI committee, and so we're looking a lot at access to care, and also, as has been mentioned earlier, I think the high level of acuity, and are there enough levels of care available? And I know that DCF is working hard on maybe increasing accessibility of mobile crisis and an urgent care setting. I'm just concerned that there isn't enough funding set aside for that work. And I also know that there's been a tremendous amount of work on DCF's end around alternative payment methodology. One of the things that is a big barrier as a provider in the schools, we're embedded in all of Norwalk Public Schools, as well as 12 schools in New Haven. And we were in Sandy Hook in the recovery effort, is billing the traditional fee-for-service billing within a school setting is really problematic. you have to get licensed, you have to be able to be in enhanced care clinic to be able to get the enhanced rate. And, as you know, Alicia, I think as a principal or anyone else who's in education, there are usually 5 kids waiting for the therapist, one in the office, and one half in the office, and then the 3 sitting in this, in the hallway outside. And not all of them are officially children clients. And I know that the bill addresses that a little bit around a child can see a therapist 5 times before they can, before parent notification, I think is what it said. But you can't bill unless you have parent notification. So it's a bit of a catch-22. So the whole billing system related to school mental health needs to be turned around.
Thank you.
And I'd be happy to pull more information. I have a ton of information about that. I'm trying to upload some things now.
Thank you. Who I see, have we heard from Ted today? Anything to offer? Christine?
Hi. So I see you've written a little bit about school-based health centers above, but I just want to add the importance of them. And we've seen a lot this past year during our COVID times with school-based health centers and the importance of the mental health services, because we actually have held about steady with our clients being served at this time during COVID, even with school shutdowns, and the importance of telehealth during this time too, because the children who need these services have had a seamless transition, often contacting their provider through a telehealth service if they can't meet them in school. So they do provide valuable services, mental health, as well as medical, and some with dental services at the school where the kids are at daily. So these are great options for parents who can't necessarily get their children to the doctor during the day because they're working, or even after school hours. And to add a little bit more, you were just talking about the vaccine rates. Vaccines can be provided at the school-based health center. So seamless service can be done for these kids at these locations.
Christine, is there any concern that the telehealth will end because we're hopefully in the waning stages of the
Yeah, I
pandemic?
know. There's been a lot of discussion about that, but I'm not 100% sure the route it's going to take. We're obviously trying to keep promoting the positivity that has come from it. So we'll see where it goes.
Right, we can include that. Yes, thank you. Roseanne, you're waiting patiently. What would you like to add?
Well, I had started to say something else, but I do want to add something about the mental health, just to add with people that this issue about the scarcity of providers has been going on for years and getting worse, and not just with therapists, but with psychiatric providers to do the medications for the children. So that's a real a need, both in school-based health centers and in clinics. And the other issue is for people who are using their own private health insurance, how does that translate when they need a service that only is available to Husky patients? We're not sure how to do that, but I wanted to add a couple other things in terms of health. And one of them is the issue of having safe housing without any lead. And I had written that there was a program in Philadelphia that you have to obtain a certification showing that you're lead safe or lead-free housing before you can rent your actual apartment, rather than going in afterwards. And I'm not sure at what level that can be done, the state, federal, or local level, but that's something I surely would like to see. And the other thing is, when I talk about a therapist working within the environment. The environment needs to include climate change. There's a lot of information now that shows the discrepancies for vulnerable people. I just went to another conference about the need for parks and open space and how much that can help people who have mental health issues, both preventing and helping them when they start. But that has, again, that's not as available for vulnerable people.
Thank you. Roseanne, have there been any ideas to help with the scarcity problem of the providers?
I mean, I can tell you I wrote about a lot of the part about dealing with children is what it takes to deal with a child's issue. It's not just dealing with a child, it's dealing with a school, it's dealing with all of these other issues that you have listed here. That takes a lot of work. It takes a lot of work because you're doing both case management and advocacy and whatever. And I'm not so sure that people who do the work are actually, people just don't acknowledge, I don't think sometimes, all the work that it takes to do that. I don't know about the reimbursement rates that go along for all of this work that we're doing.
That's really going to impact. Yes. Go ahead, Christopher.
I was just going to say the scary thing is Massachusetts ratio is the best in the country. It's 150 service providers to one patient. Connecticut's is still, I think, in the top 8, and we're 240. It's one provider to 240 patients, and we're among the top, which is terrifying. So I mean, I don't know to what extent the state legislature can be involved, except that they do work with insurance companies and regulations and so forth.
Right.
So maybe, Roseanne, it is an issue of the reimbursement rate. And then another thought I had, because I think this also pertains to educators, although this wouldn't be under the heading of healthy, is the amount of training that somebody requires in order to be an educator or in order to be a mental health provider to the pediatric population is pretty expensive. But the amount of pay that those folks who are doing that work get is certainly not sufficient to pay off their loans and anything approaching swiftness. So I think that's really contributed in education to the lack of non-white, non-middle class educators. But it also decreases the number of educators overall. So I'm inclined to think that that's also the case for mental health clinicians and other providers.
And this could be another example too of a lot of paperwork needed. So another bureaucratic hurdle that people have to go through to get their reimbursement after doing the work. Alice, you have your hand up.
Yeah, I just want to agree on that. And I think that there's a couple of issues. One is that there's the school-based health clinics where many are run by local FQHCs, and the FQHC rate is much higher than a typical private provider, which is really great because that allows them to be in the school. But a lot of the private providers who are in the school are receiving maybe 50% less or quite a bit less than the FQHCs. And we have a ton of staff. The great recession or the great resignation, a lot of folks are leaving to go work at hospitals or in places that can pay $20,000 to $30,000 more salary. So we're seeing folks, at least one a month, if not more, who are leaving for higher paid jobs. So as Christopher said, the school reimbursement, tuition reimbursement would be an incredible add or incentive to keeping folks employed in the private providers. I just also want to talk about health a little bit as, in specific asthma. Asthma is the highest health issue addressed our kids in the New Haven region. That is, there's a lot of social determinant relationships to that, including, as someone talked about, the Roseanne, the environment, climate, those kinds of things. But I think that that's an area that could be really focused on from a public health perspective. Many of our kids are, having asthma, and unfortunately, a lot of them are using the emergency department for medications because they don't have a primary care.
Thank you. Well, he's finishing that. Kathleen, do you have anything to add?
Hi, Katie Durand from the Department of Housing. So I had sent a few documents in our annual action plan, as well as our consolidated plan,
Yes.
as well as a list of our current programming. Just to speak to a little bit of that, folks had mentioned lead, I think, in our annual action plan, and as well as the program description sent. We do have a Healthy Homes initiative that we partner with the Connecticut Children's Medical Center on, and there's some details on that to raise awareness around lead paint hazards and other hazards within the home, as well as to mitigate them. In addition, I think we talked about how we are always striving to increase the amount of affordable housing available to individuals and families in Connecticut. This includes subsidies such as our state rental assistance program, as well as our federal rental assistance program, and other programs that assist specifically populations who are experiencing homelessness, as well as renovation and development of affordable housing through our development funding.
Thank you, Katie.
Yeah.
Carol, would you like to add anything?
Can you hear me?
Yes, go ahead. Now we can.
Yes. So I had also sent something in on behalf of Demas. I did that late on Friday, so I'm not sure whether you had an opportunity to look at it. What I can tell you is, being not as familiar with the ASCD's framework, I took a stab at the tenet associated with the issue that was referenced. So I would just ask you to, those of you who know this, to look at it to see whether it matches the point that's being made. But I guess just to back up a little bit, at Demas, we provide aftercare, recovery, and treatment services for adults that are 18 and older. And in terms of services for children, that is under the purview of prevention. And those programs are really designed to reduce the likelihood of substance addiction, gambling addiction, as well as to promote emotional health. So with that being said, many of the issues that I addressed in the document that I submitted were across the continuum. So prevention, treatment, et cetera, et cetera. So, and it really repeats what's been said before around mental health services, more school-based programs, more support for families. You know, again, these are along mental health, gambling, addiction, and substance abuse and addiction continuum.
Yes, thank you. I'm not sure you were here at the very beginning of the meeting. You know, did an excellent job here. And I went through and highlighted those that you had marked as healthy, as great examples. And they should be at the beginning of this document. You just can't see it right now because we're sharing the screen. But thank you for that. And I did have a chance to review that. I'm sure Christopher did as well. And we thank you.
You're welcome.
Tanya?
Before Tanya speaks, can I ask
Please.
a question? As I was going through, you know, what people submitted and as I was reading a lot of other documents, so I'm glad Carol's on the call and Alice in particular as well. You know, there are a lot of data about you know, kids' mental health diagnoses and access to treatment or lack of same, but there's a lot of data as well about parents. Mental health diagnoses or addiction diagnoses and access or lack of same to treatment. So my question is, and this is just, it's sort of a probably semantic, but to my way of thinking, we would deal with the parent lack of access under safety and deal with healthy, particularly to the diagnoses of and treatment of kids. I don't know how you all feel about that. And Roseanne, you too. How you guys think of chunking those two things?
I would agree, Chris. This is Carol.
Okay.
You know, as I look at the points under the tenets for safety, definitely an adult with a substance use problem is going to jeopardize the safety of those children. And so I would, you know, I would classify it as such.
Okay. Thank you. Yeah, as I say, I mean, it was clear to me that we wanted to address it. I just wanted to make sure we adjust it sort of in the appropriate place. But I see Roseanne and then Alice.
Yeah, hi. You know, that's fine if you put it under safety, but for me, it belongs in under health as well, because it's hard for a child to be healthy when the parent is struggling so much. So I guess you have to make a decision, and you know, I don't know. You know, you have to decide which way is the better way, but I see it as both.
Yeah, I think it is hard to have a healthy child without a healthy parent with that child.
Well, I mean, the truth is we could address it in both places.
True.
Yeah. Thank you for that. Alice, I'm sorry.
Oh, that's great. I agree with everybody what they just said. I put up on a link the work we've been doing at WestCon with the, UConn, with the whole child approach, but we included whole community and whole family. We believe as a child guidance clinic that you have to approach all of it with a whole family approach. When you're talking about asthma, you're talking about social determinants that are impacted, you know, mostly through parents. So, you know, I just think that you can't think of any of the categories without thinking about the whole family. And you know, as someone said, you can't specifically address something with the child without really impacting and trying to see what the environment is that they're in.
Thank you.
Let's see now, maybe Tanya, do you have anything you'd like to add?
Good afternoon. I am traveling out of town for a funeral and I'm not in a quiet location. So I don't have anything to add other than what we submitted in writing.
Thank you very much. We understand. Thank you for coming despite your loss. Yes.
Thank you.
Anyone else? Did I miss Anne Marie? Did you want to add anything, Anne Marie?
You know what, Alicia, we can obviously bounce back because
Absolutely.
the categories are mere constructs. So
and Roseanne has her hand, I think. Did we add something else, Roseanne?
Yeah, I just wanted to say a little bit about what Alice was talking about in terms of asthma, because I once did a mindfulness little discussion with some of the doctors who treat asthma, and they were saying how there used to be an allergy season, and there's no allergy season anymore due to the climate changes, and it's gotten really bad. And the asthma also is part of the anxiety that a lot of these children feel, or the other medical issues. I'm not sure I could list all of them, but adds to the child's anxiety. And there's a lot of anxieties for elementary school children.
Certainly, thank you. And we will add this, Dr. Christopher, you've done a great job, thank you. If there's something that you would like to add to this, or that we didn't quite capture as you would like, do be sure. We'll add this. Can we add this, Christopher, them giving them rights to be able to change so they can make an addition?
It's in the folder, but yeah, I'll have you teach me how to do that if I didn't do that correctly.
I'll do that when we get done. No worries.
Okay.
That would be great. Otherwise, anyone can just send either one of us an email. We'll be happy to make the change for you. There's a lot going on here.
Sure.
Anything else from anyone else under the healthy? And as you said, Christopher, we can always go back to it as well. But maybe it's time to move on to safe, unless anyone has anything else at this point to add under healthy. Okay, so if we go back then, you can, as I did the first time with the healthy, you can see that there are some examples of safe in these folders. And just looking at the top, do you want to go over just so people can hear the elements of safe, Christopher?
Yeah, and I think hopefully you can see it.
Yes.
I scrolled to the top. But under safe, we were thinking of safe as such things as neighborhoods free from violence and environmental hazards, emotionally nurturing homes that are, absent physical or emotional abuse or neglect, families that are supported to provide healthy environments for their kids, housing that is secure and consistent and well maintained and well heated and ventilated, free of lead paint and other toxins, and is affordable. And then also, in order to be safe, families need reliable private or public transportation, in order to get safely from one place to another, in order to get to healthcare, in order to access food and so forth.
So I can start, Christopher, reminding people of what's in the CHRO document, which includes bullying under one of those as something to consider for safe. We know there is legislation, anti-bullying legislation already that we are bound to that should help students, but that's in here, as well as any kind of discrimination complaints, more in regard to denial of accommodations that are necessary under any of the protected classes. They also talk about their current work, the annual Kids Speak Day that CHRO puts on for students to come together, talk about civil and human rights issues, and also an essay competition. They have an academy, a Kids Court Academy with the commission, an 18-week program that the commission does in collaboration with Connecticut Bar Association, UConn School of Law, and Connecticut Bar Foundation that helps students understand more about civil and human rights laws. They also have a poster contest and work with the Hartford Public Library to continue outreach that the commission is involved in. And they also put one more thing, that they have a robust internship program to help people and students engage in a variety of civil rights issues that are related here to students being safe. So that's listed in this folder. Let's see.
Thank you for highlighting that, Alice. I appreciate that.
Yeah. Anything else you want to add? I know it's hard for you, but fine. So we do have it here and we can go back, and I just did a quick highlight. I did not do it the service that it really deserves, but just an overview.
I appreciate that. We also focus on their mental health as well. And so the bullying actually highlights that portion of it as well. So I appreciate you focusing on that.
Yes, we will, certainly will. It is important. Thank you. I have a great document here from Demis, but maybe you would like to highlight yourself what you have put under here. If not, I can do it, but So safe here is housing, is listed as an important part of safety, safe, supportive, affordable housing if people are going to be safe and recover. And the family unit is listed here. Increase access to transportation, which we've discussed under healthy too, and addressing language barriers and child care issues, which can interfere with people's access to services. And those barriers can also jeopardize the family unit. So they're listed under safe as well. Okay, anyone else? I'm sorry if I missed anything or anyone. Yes, Colin, please.
Hi, Alicia. One thing I just wanted to add again, something that we're seeing pop up in our public schools is, I don't think it's a crisis level yet, but when we talk about safety from violence, I do think we should be also keeping in mind state-sponsored violence. This is a conversation that's coming up in terms of how we engage with school resource officers in our schools, and particularly how Black and Brown students are subject to disparate treatment when it comes to discipline. And I think it's an important thing. We want to make sure that when we encourage our young people to reach out to the proper authorities for safety, that they feel safe doing so.
Is this where you would talk about work maybe more toward restorative practices versus discipline?
Absolutely. Yep. I think it's definitely part and parcel.
Roseanne.
Can't get my unmute. Okay. I'm sorry. I just wanted to add that I had listed a program, I think it was down south, I can't remember now, where they had fathers come in and be in the schools to stop some of the violence in the high schools and how well that worked. So maybe adding some of the community, the parents themselves to get involved in helping.
Thank you. Who would like to add next for safe? Tracy.
I just want to go on for what Roseanne said. I think in terms of community violence, one thing that we saw, I'm sure you've seen it all within the news, there's been this uptick in violence, particularly car theft. And I think what we found is that because of COVID, so many of these kids did not have that connection to school, to counselors, to any pro-social outlets. And so there's been a real push to really look at our community and try to get those connections for those kids, and look at mentors, getting probation more involved with hands-on within the community. So I just wanted to mention that, I think COVID played a real role in that because just there weren't the resources that were out there. The other thing that comes to mind under safety is, we have a family engagement initiative that probation is overseeing. And, you know, with anything similar to, I think Roseanne said, and maybe Alice, that if you don't have a healthy family or even an engaged family, it's going to be really difficult to make change. So I just wanted to say that that is something that's really important. And then last but not least, in terms of basic needs or transportation, I do want to say that one thing has been helpful, at least to kind of assist with this, is that we offer families and kids gift cards for buses, gift cards for basic needs. And we found that that's been tremendously helpful. It takes this pressure and stress off of families, but more importantly, you know, just for them to get their basic needs met. So that's it.
Thank you. Carol.
I always have a problem with the mute button. So in terms of the DEMIS responses here, under SAFE, we talked about maybe exploring support for children and young adults who may need to titrate off stimulant medication. In terms of some of our other areas, other being outside of gambling, gaming, you know, substance use and mental health, we talked about increasing access to supportive and affordable housing. I think that's been addressed several times here already. You know, of course, that is a critical factor to achieving or maintaining recovery, certainly, and as well as family unity. We also talked about addressing language barriers and childcare issues, which may interfere with access to services and, you know, which may also jeopardize the family unit.
Right. Thank you. Roseanne.
Thank you. Yeah, the one thing that I noticed that hasn't been mentioned is the gun violence that goes along in the environments that my clients live. They have guns being shot off in their parks, being shot off in their actual apartments, having to see guns, hear guns. Kids can't feel safe if that's going to be part of their environment. And I listed a program that was going on in Michigan where they were giving guns. They were not giving guns, they were giving jobs to people instead of locking them up for things that weren't so severe. And I was wondering if we could, instead of giving money for guns, we could give people who had guns jobs, or said that they could get some kind of training. There's going to be a lot more jobs, I understand, available in Connecticut as some money comes through federally. So there's a program going on in Michigan for safe communities, and that's part of what they want to do.
A very different kind of gun buyback program.
Mm-hmm.
Right. Alice.
I know that homelessness or housing is on there, but I think we have a significant number of 16 high school kids who are homeless, who are not literally homeless, meaning they're couch surfing, and especially around the LGBTQ and questioning group. So that would be an area of great importance, especially for us down here in New Haven. We're opening a youth shelter for 20 kids, but I'm sure we could even see a lot more than that. So there are not many shelters for the young kids.
Thank you. I don't see any other hands. Would anyone like to add anything else?
Roseanne?
Yeah, I'm not sure, you know, it sort of belongs under both of these categories, but it's the issue about how tired kids are. kids and insomnia for both parents and children under COVID has been one of the 3 top diagnoses besides depression and anxiety. And the other part of it is that we need to be on top of what's going on in the brain research, because what they're saying now is children can have long-term COVID, which means that we might be dealing with many different problems for a long, long time. And we need to be on top of what they're saying.
Are there any other reasons given for the fatigue and insomnia?
Gaming.
Gaming, yes, okay.
Mm.
That makes sense.
Electronics,
Right,
but also COVID.
right.
While people are still noodling, you know, as we mentioned before, our thought was, you know, to do this same practice the next time we meet, but for the remaining 3 tenets. And then between that meeting and our final meeting, what we will have done is started to sort of draft a report that takes into account all of the submissions that people had already made on paper, as well as the comments that people have given during these sessions. And in our final meeting, people will have an opportunity to sort of, you know, examine what we've written, examine the recommendations and the asks that we're making. And I think that will be particularly important for the agencies and the organizations. You know, I think when we go to the legislature, when we go to the various committees of jurisdiction, you know, given everything else on their plate, we'll really be doing them, as well as ourselves and our kids, a favor if we say, this is particularly what we're asking for. Specifically, this is what we need. And I'm certainly happy to go to the committees and sort of make presentations, as well as you guys at your agencies too. But as I say, the more specific we can be when we get to the asks, I think the more likely we will be to get some of them met.
Right.
Christopher, I'm sorry, this is Alice. I'm sorry I'm talking so much.
No.
You
You're
can
making
tell
up for
I'm
lost
really
time.
excited around this topic. But I sat on the Sandy Hook Commission for quite a few years, actually, and we made a very, very thorough report that had a whole section on schools that many of the recommendations were never adopted. So I think sometimes it's important historically to point to, you know, both the behavioral health plan that DCF is putting together and the Sandy Hook report, which had, you know, very similar to what you have currently, people really looking at what needed to change around safety and also school safety, but health and wellness in the schools. And I'll post the final Sandy Hook report up. But I think what I've been doing over the last 9 years is just reposting the recommendations, because, you know, at some point, I think 10 years is the time.
Well, there were pages of recommendations, if I recall.
Oh, like 180.
Right,
Yes.
I recall a lot, yes.
But we put a lot of time and energy into
Oh, right.
Yeah.
Right. Yeah, I'm sure many of them do come into play after a pandemic.
Yeah. Well,
You know,
and
the
Alice,
trauma.
and I don't want to belabor the point, because I know we're closing in on 5 fast, but you know, Alice, one of the things that we had said last time, oh, I just lost my train of thought. I'm just going to blame that on the time change.
There you go. It's the excuse of the day. Yes.
It'll come back. It'll come back.
No worries. Just checking for any other.
Oh, now I
Go ahead.
remember. What we had said last week, and I think it's important, is I think, you know, there will be those in the various branches of government and in the public who will be inclined to chalk up all of the problems we're mentioning to COVID.
Oh,
So I think one of the things that we're going to have to do, and that's why I think the Sandy Hook report is a really powerful example of this. We have known for a long time that we've had these issues. And we really need to sort of get out ahead of the fact that some people are going to minimize some of them, just sort of chalking them up to COVID. So we're just going to want to make sure that we point to the Sandy Hook report and say, no, we made these recommendations a long time ago, and they're, even more timely now than they were then. So, the time to act is now.
well, as Roseanne pointed out too, we don't even truly know all of the long-term physical or mental effects of COVID. So yeah, that's important to us to reiterate what's already been learned. Anyone else? I think we have a lot today, Christopher, and even some more things now we can reference that will help us to build our report before the December 6th meeting. So how many weeks? The next meeting is November 22nd, which is 2 weeks from today. Same place, same time. And we will hope to finish the last 3. I think we can, now that we have, this process down and people have come with a lot of information already, then we can look at those that repeat, that really then must be an important part of the final plan, or some new things that come from looking at engaged, supported, and challenged. Anything else, Christopher? Because I think we're seemingly, oh, Carol.
I'm wondering if for our next meeting, for those of us who did submit something ahead of time, if that could be reflected, in the
Sure.
document that we're going to be populating.
Sure, we can do that in advance. Thank you. Yes, you had done a nice job. So yes, we could do that.
Thank you.
And if you didn't have any, again, this is the time. So either way is fine. And you might have some ideas by hearing others. So we appreciate your being here to be sure that we captured everything.
No, I'm just very grateful to everybody for your time and for your contributions to the discussion. I do think that we're going to be able to create a report that's cogent, and hopefully we'll get some action on it. So thank you, everyone. And Alicia, I'll leave it to you to sign us out.
Right. I was going to say, and for the next 10 years, maybe as the Sandy Hook report, this will go along with it, because there'll be enough information, certainly for more than one budget cycle. Right. So thank you, everyone. And again, we will share the agenda as a reminder for the next meeting, which is November 22nd at 3:30, once again online. Thanks, everyone. In between now and then, please be sure to share any questions or comments. We're happy, either one of us, to receive them. Thanks, everyone.
Thank you, both of you. Thank you.
Bye-bye.
Good night, everyone. Take care.
Good night.